And welcome back to the program. Well, we've all got those things in our body. When we look in the mirror, we think, I don't exactly love this part. Well, joining us today is Dr. Michael Clinton of Clinton Plastic Surgery, talking about how we can fix some of those problem areas. Welcome to the show.
Thank you, Nicole. Good to be here.
So it used to be back in the day, people would say liposuction. Well, that's changed and evolved. What is it now? Yeah,
the term liposuction has really become passé. It doesn't describe what we're doing these days. Lipoplasty is the term that we use in the office most of the time because we're using energy to assist us in removing unwanted fat. It used to be we just suction the fat. Now we either emulsify the fat with ultrasound or we actually melt it with a laser and then we aspirate or remove what's left over.
Okay, I want to talk about some of these pictures. They speak 1,000 words. So this is a before and after, right? This first one.
It is, and I brought examples of upper arm treatment because, you know, our First Lady is known for her great looking arms, and it's been a real resurgence in the desire to have good looking upper arms. So we do a lot of what we call upper arm lipoplasty. We used to do brachioplasty, which actually put a scar on the inside of the arm, and now we don't have to create a scar there. We put just a little dot where the liposuction cannula goes in.
So you guys are actually taking the laser for essentially, and you're looking at a problem area like this, for example. You're melting that away, and then you're using this, which we would know as a device that kind of gets it out, right? Sucks it out.
Right. This is the aspiration cannula that we actually remove what's left over. And you can see it's very small. They started out many years ago being very, very big.
Yeah.
Now they're like 3 and 2 millimeters in diameter. So the little hole that we have to go through is just like a little dot.
Yeah, and does this, okay, here's the big question. For women or men that have this, can the fat come back, or once it's melted and sucked out, is it out for good?
No, most everybody agrees that once you become an adult, or heal like an adult, like mid-20s, that you have a fixed number of fat cells. So if you remove the fat, then it's forever gone.
Okay.
Now the fat that's left behind, that can hypertrophy, that cell can get bigger, but you can't create new fat.
Create new fat. Interesting. And what about recovery time for something like this?
Well, it'll depend on how much we do, and we do a lot of different areas in some patients, and they're still back to work in a couple of days. But if you do just a small area, certainly they can be back to work the next day, and it's all hidden under your clothes, and quick recovery.
And are you unconscious during this so you don't feel the pain?
Well, once again, it depends on how many areas that we do. If we do multiple areas, oftentimes we do put someone under a general anesthetic. But if it's a small area, we can do it under a local anesthetic with IV sedation. So there are options.
So obviously you just brought the arms, but as you said, you do all different body parts. If people want to get more information, they want to learn more about what you do and how you do it for maybe themselves or maybe a loved one, how do they do so?
Well, of course, ClintonPlasticSurgery.com can help them, and we have people in our office, real people, live people that'll actually talk to them and give them prices and give them ideas about expectations and recovery and things like that.
And there's the website and phone number up on your screen. Again, ClintonPlasticSurgery.com. They do pretty much the whole body, and if you are looking to tone up or slenderize, they may be your answer. Thank you so much for your time.
Thank you so much.
We appreciate it. We've got to send it now over to Ebony, who's standing by with God's Daughters.